Hey guys, welcome back to the channel here at Retirement Planning Made Easy, and welcome back to the podcast if you're listening through that instead of watching us on YouTube. This time of year that started on October 15th through December 7th is what is known as the Medicare annual enrollment period. Now, what that means is if you're on Medicare already, you have this window of time that you can choose a Medicare Advantage plan, or you can choose a Medicare Part D prescription drug plan. And the choices that you make between this window of time, October 15th through December 7th, will go into effect on January 1st. And under most circumstances, that will be the plan that you will have for that remainder of that year. There are some exceptions where you can swap plans, things like that, in certain times of the year. We're not going to get into that today. But the big question is, how do you find the right Medicare Part D insurance? Because there's a lot of different plans that are offered based on the zip code that you live in. And a lot of times the plan that is the cheapest premium may actually cost you more out of pocket because they may have higher copays that you pay at the pharmacy. So today on this video, I'm just going to share my screen with you and show you how you could, in the comfort of your own home, go to Medicare's website, put in the information that they're asking of you, and you can click a big button that says enroll and put in your information and actually enroll online. You have that option. You could also, the other way you could get a Part D prescription drug plan would be going through an insurance agent. That's an option. Sometimes what I'm going to show you here today, sometimes you can ask your pharmacist to do this for you with looking up everything, and they can walk you through where to click the enroll button after they have input the prescriptions that you're taking. So let me pull up my screen here and we'll get started. Okay, so you can see my screen here. We're just simply on Medicare's website, which is www.medicare.gov. And as you can see, this time of year, they actually have their website set up as a really simple way of really accentuating the fact that it's open enrollment. And we just click on this button that says Find Plans. So you click on that, it's going to take you to a page that's then going to ask you what zip code you live in. And you go down here to the zip code, punch in, I'm just going to use my zip code 38372 here in Tennessee, and hit continue. And then it gives you this option, what am I looking up? Am I looking up Part C Medicare Advantage plan? Am I looking up a Part D drug plan? They got some information on Medigap policies on here too, but really Part D drug is the one that you're going to want to click on for this. And then you just click Find Plans. Now they give you these options on here of, are you on Medicaid, which means like you're dually eligible for Medicare and Medicaid? Do you get, SSI? Do you get any extra help from Social Security? If you do, you check whichever one applies to you. If you know that you don't get help from any of these programs, which is most people, just click on that button that says I don't get any help from these programs and hit next. And then when it says, do you want to see your drug cost when you compare plans? You definitely want to see that. Hit yes. That's important information. Now, this is where they ask you to input, your prescription drugs that you're taking. So let's say you're taking something like lisinopril, for example. It actually populates it for you. As long as you spell it halfway right, you punch that number in, that letter in, and then it populates the full lisinopril, and you just say add drug. And they're going to ask you, well, do I take 10 milligram tablet, 20, 30? You just put whatever in there for yourself. And if you like to get it filled every 3 months and you take 1 pill a day, well, that's 90 pills is going to last you for 3 months. And you just kind of fill that in. Really self-explanatory there. And you can always rewind. That's old fashioned to say that. We don't use film anymore, but you know what I mean. You can rewind this video here and go through it and watch it again. So you just click add that to my drug list. And let's say you take a number of drugs. Maybe you're taking something that's maybe a little more expensive, like say Xarelto, for example. You can put that in here as well, and just choose whatever your dosage is, how many you take, all that. We'll just say you get 1 pill every day and you refill it every month. So 30 pills last you a month. Go through all of that for your own situation. And once you've put in all of your drugs for your what you're taking, then you just click done adding drugs. It's a big green button, pretty self-explanatory. And then they let you choose which pharmacy you like to use. Now, this is really important because the pharmacy that you like to use may be in network with certain Medicare Part D prescription drug plans, or it may be out of network. And whether it's in or out of network, it's going to determine which insurance drug plan is going to be the best one for you, that's going to save you the most money at the pharmacy that you like to go to. Now, they allow you to put a couple of them in here. So let's say I just choose, like, Walgreens, that might be one. Kroger might be another one, and they allow you to pick up to 5 pharmacies that you might potentially be interested in using if you're not loyal to any one pharmacy, for example. So let's just put in, like, Walgreens, Kroger, CVS, and we're going to hit done down here in the bottom right corner. So we hit done, and now it actually populates up a screen of what are the best drug plans for you based on the zip code that you live in. And you can see, so this one's starting out, it's got one that says Farm Bureau on it. It's got a price on it, $76 a month. There's one for WellCare, another Farm Bureau right here. Here's an AARP one that works with Walgreens. Here's a lower cost premium one with SilverScript, $12.30 a month. Now, what's interesting with this is that the premium, so you'll notice, like, the first one that shows up has a high premium, like of $76 here. And you'd think, well, maybe I don't want to pay that much. Maybe I want to buy one that's got a lower premium. Well, the number to look at is really what's your total drug cost that you're going to pay to the pharmacy, plus the premium cost, plus that $76.70 in this case. And you want to look at this number and make sure that it's as low as possible. So the first one that they list is the one that has the lowest number. In other words, the one that saves you the most money. And then going down, you'll see the next one in line is a little bit higher on the actual cost you pay. And if you even go down in this case, based on the 2 drugs that I put in, lisinopril and Xarelto, you can look that, you could buy SilverScript for $12.30, but your total out-of-pocket cost is about $1,900, and that's more than what the first one was that had the higher premium. So at this point, all you do is you'd click on plan details, and you could actually look and see how the plan pays. And you've got this display here. You can go down here. You can see that Kroger, for this is the Farm Bureau Select RX plan. You can see that Kroger is the preferred in-network pharmacy for that. And then you can just scroll down and you can see, okay, well, what would the Kroger prices look like? And you can see that lisinopril is pretty inexpensive. Xarelto is more expensive. And that's where a lot of your cost is going to be coming from in that case. Now, and then if you wanted to enroll in this plan, it's really simple. There's just a big green button here that says enroll. It says this is the plan you're about to join. And then this is where you put in your information. You got your Medicare number. And then as you keep hitting next on this green button down here, it's going to ask you for more information, like your name, your address, date of birth, telephone number, that kind of stuff. It's an application is what it is. And then once you get through it, it'll give you a congratulations, you have made this selection. Now, I want to show you something interesting. Let's say you're just taking that lisinopril and Xarelto, but let's say you're in like a situation where you're not going to be taking Xarelto and you want to just see, well, which plan would be best for me if I wasn't taking this expensive drug? Or let's say you're able to get free samples of this one, or you've directly written to the name brand company and they're able to give you a lower price on it, and you wouldn't be claiming it through your insurance. And so you don't want your insurance choices and results to be skewed by a prescription that you're not actually claiming through insurance and paying. So if we just remove this one, just to give you an idea of what this does to your outcomes and what your best plan is, and let's say you're only taking lisinopril, you can say, I'm done adding drugs. I'm going to keep all these pharmacies here. I'm going to click done. And then suddenly the best plan for you is no longer that $76 a month premium one, but there's actually one that only costs 50 cents a month. Wow, that's a lot different right there. So you want to be aware of how what prescriptions you add that you're taking are going to impact which plan is going to save you the most money. And if you're not claiming a particular drug through your insurance because it's an expensive name brand one, you've been able to talk with the company and write to them and say, hey, I need financial assistance in getting this drug or whatever, then you may not want to include it because it's going to skew the results where you might wind up paying a higher premium for a plan that's only getting lisinopril, like a very cheap generic drug through it. So in this case, let's just go ahead and click the button, go down the rabbit hole with this one. This is a 50 cent a month plan. You heard that right. A 50 cent a month plan. It's kind of crazy. And again, you can see all the preferred networks with this WellCare product. All of them work: Kroger, Walgreens, whatever, CVS. And you can see that lisinopril has a retail cost of $7.85 for a 90-day supply, but the cost that you pay using your insurance with this plan would be zero. So that means all you'd pay for the whole year would be that 50 cent a month premium times 12 months, which is $6 for the year. Well, that's a lot cheaper if you've worked out something with a more expensive drug like Xarelto with the name brand company. And then again, process is the same. You just click the big enroll button right there. It's a big green button. Start putting in your Medicare number, your information, all that stuff that identifies who you are. And next thing you know, you are signed up for a Part D prescription drug plan. So it really can be that simple to do. Okay, so now we're done with the screen share. So let's talk about some of the takeaways that you need to keep in mind when this time of year, if you're on Medicare and this time of year comes across, what do you need to be understanding on this? The best drug plan, Part D prescription drug plan for you depends on the prescriptions that you're taking and the pharmacy that you like to use. So it's not, you may be a husband and wife team and your husband could have one prescription drug plan that works better for him than what works for you as the wife, because you're both taking different levels of prescriptions, different types of prescriptions, and one would pay better with one company versus another one, or maybe one would pay better because you choose to use XYZ pharmacy and somebody else uses ABC pharmacy, and that can impact which drug plan is going to be the right one to use. The more expensive that your prescriptions are, this is a good rule of thumb, the more important it is to shop it around yearly, because these plans do change every year. So what that means is that the plan that you have this year, you may be very happy with it. It may be paying well for you, but they may change how some of the copays and the coverages or the tiers that the different drugs that you're taking might fall into come January 1st. So it's always a smart idea to shop this around every year. Now, there's a couple of ways you can do that. You can watch this video again, and you can watch how I just did it if you're a DIY, do-it-yourself type of person. Another thing is that a lot of times your pharmacist will help you out, especially if you're using like a locally owned smaller pharmacy instead of one of the chains, but sometimes the chains may have pharmacists there that even help you out with that as well. And the reason they'll help you out with this is because they want you to find the prescription drug plan that's going to pay best and save you the most money at their pharmacy. And so they are incentivized. They will look this up in a lot of cases for you. You just have to ask for it. If they don't do that, you can either do it yourself. There's also, you might want to use an insurance agent that does this. There are some that do this. There's not many that do this, but there are some that do this as well. So again, just those takeaways. I can't emphasize this enough. It's really more important for you to do this and check this every year, especially if your prescriptions are expensive. Because if you've got a plan that's doing very well for you this year, and it's doing some and paying a lot of covering some expensive drugs that you're taking, you want to make sure that you're staying in a new plan for the upcoming year that's going to do the best for you as you can on that to minimize your prescription drug cost for sure. That's all I've got for you guys for today. If you need any help planning for your retirement, feel free, head on over to my website, retirementplanningmadeeasy.com. You can download a copy of our essential step-by-step retirement guide. It's going to help you plan for your retirement, and I'll see you guys on the next video. Thanks.